Let's begin an in-depth discussion with experts from around the world. COVID-19 has now spread to more than 140 countries, rendering it a truly borderless disease. In response, a growing number of governments are sealing their borders, and some have even gone so far as to blaming foreigners for the virus. To look into the issue, we have joining us today Dr. Mark Shanahan, Associate Professor of Politics at the University of Reading in the UK, and Dr. Joseph Bosco, Opinion Contributor to The Hill and former China Country Director in the US Defense Department. Well, first, my question goes to you, Dr. Shanahan. As countries grapple with the pandemic of COVID-19, we're seeing a growing number of travel restrictions and bans that you're actually affected by, having to put your plans to the US on hold. Well, with the virus actually having affected more than 140 countries, do you think this kind of travel restriction will work at this point?
It's probably too late in reality. As you said, the virus knows no borders and is already settled in most of the countries of the earth. So what we're seeing with the travel bans, to some extent, is political posturing rather than an effective public health response. But there is some virtues and some value in it. We don't really want sick people travelling across borders where they are going to impinge on the public health systems of whichever country they go into. However, these travel bans have to be managed very carefully. What we can't do is stop trade. So goods, services, where possible, still have to travel across borders. Healthy people still will need to travel in some ways to some places, but we want to minimize the risk of the virus being taken into areas where it's not yet really set foot.
Well, it really is incredibly difficult to hit that sweet spot, though, isn't it? Containing this virus, but also allowing everyday life and the economy to run as it is. But Dr. Bosco, this virus, like others, it knows no borders. But some leaders are actually deeming COVID-19 a foreign virus and closing their borders and even pinning the blame on other countries. So what is the danger of turning this public health crisis into a rather political one?
Well, I'm afraid in the world we live in today, almost everything ends up being political in one form or another. I think the first country that began to point fingers was, in fact, the country where the disease originally emanated from, and that was China. China and Russia have both been issuing rather strange statements recently, at least public officials have from those countries, to the effect that the virus started with a U.S. Army operation of some kind. They're even suggesting biological warfare or some very strange theory, and that's not helpful to the situation. I think President Trump has responded in a statesmanlike manner, but it is true that it's, in the sense, a foreign virus and that it started somewhere else. He has responded to those specific allegations by saying, I think his words were, "We all know where it came from." But the more important question, of course, is, as Dr. Shanahan points out, the virus knows no borders, and this should not be a political issue at all. And it's a tragedy for the world, and it needs to be addressed collectively, hopefully, to the extent countries can cooperate.
Right, and in fact, you actually mentioned recently, Dr. Bosco, that this has rather led to the spread of disinformation actually generated by some governments. Could you expand on that, please?
Well, as I indicated, I think it's pretty clear that it started in Wuhan province in China, and it was not handled very well in terms of transparency and responding in a timely manner. And as a result, it spread in epidemic proportions within Wuhan and Hubei province, well, Wuhan city and Hubei province. And the world noticed that, and the world commented on China's desultory response to the virus, which, by the way, is not the first time. There have been epidemics in the past that started in China or were aggravated by China. And the response of the Chinese government was very similar in those occasions. It was not transparent. It was not cooperative. Even today, it belatedly allowed the World Health Organization to enter the country it has never allowed the Center for Disease Control in the United States to enter. So it's kind of had a guilty conscience and is starting to lash out by pointing fingers, saying, well, it never really started in China, or if it did, someone else was responsible for that. So that's not a healthy response, and it's quite irresponsible given what the world is facing.
And in addition to playing the blame game, well, in East Asia, for example, the coronavirus situation has only worsened relations between Seoul and Tokyo, for instance, when the Japanese government imposed travel bans on South Korea without prior consultation. And of course, we've seen the rift between the US and Iran come to play as well with the COVID-19 outbreak. So Dr. Shanahan, do you think closing borders and countries putting their national interests first, do you think this could actually do more harm than good in terms of diplomacy?
In terms of diplomacy, this is a very dangerous time. It's a dangerous time for us all anyway. Most borders are lines on a map. With lines on a map that maybe were drawn for political reasons 100 years ago or whatever it may be, the virus is taking no account of those. We're really at a stage where countries need to work together, where South Korea and Japan have to bury some of that long-standing enmity for a while and look at how they can work together to overcome this. You've got two highly technologically advanced countries. South Korea's work in testing for this virus is an example to the world. And actually to build up old disputes and use this virus as a means to raise those disputes again is highly, highly dangerous and just shows the rise of populist nationalism that really is all too prevalent in the world at the moment.
Well, over the past few years, we've seen the rise of this nationalist, populist sentiment here, really. And, well, maybe then it really isn't a surprise that some governments have chosen to use this to their advantage and use the whole our country first policy in terms of tackling the coronavirus as well. Well, Dr. Bosco, do you think this is the right approach, or do you agree with Dr. Shanahan in that more global coordination and cooperation is needed at this time?
I totally agree with Dr. Shanahan. I think he's put it quite well. You know, aside from until this virus erupted, there was already the problem between Japan and South Korea, as you've noted. And some of us have observed that they're both allies of the United States, and their disputes have spilled over into overall global regional security. And it's kind of ironic to think that the ally of my ally is my enemy. It's almost the way the Koreans and the Japanese have been treating each other, and we certainly would like that to stop. And the virus should be a way of bringing them together rather than dividing them further apart.
But in bringing us together or making us further apart, political leadership is critical. Let's say, well, in the case of the US, President Trump has enforced travel bans and has emphasized that he will focus on keeping the number of deaths very low. On the other hand, leaders like the UK's Boris Johnson and Germany's Angela Merkel have told the public to prepare for the worst. Johnson said that many people could die before their time, and Merkel said that up to 70% of the population could be infected by COVID-19. So we see differences in leadership style there. But I would like to hear from both of you, but let's start with Dr. Shanahan. What kind of leadership do you think is really needed in this time of uncertainty?
Humble leadership. Leadership that acknowledges that no one nation can sort this problem out. I was very impressed by your own Foreign Minister Kang this morning. She was on the BBC in England talking about how South Korea has faced up to this problem. Transparency, being honest with the population early, unlike China. I'd love to know what's happening in Russia. Nobody seems to know what's happening there at all. And not bringing bragging rights into this. Donald Trump saying that America is the biggest and the best and the most wonderful at everything. Well, he didn't actually acknowledge how big the issue was and the problem was and tried to blame it on everybody else. That's not going to solve this. So humble leadership where world leaders are prepared to work together and find the right solutions in terms of a vaccine, the right solutions in terms of communication and technology, and the right solutions in terms of getting their people behind them to act in a way that will reduce the spread.
I see. Humility and transparency. Well, Dr. Bosco, what do you think we need to see from national leaders across the world in tackling this public health crisis?
Well, certainly a measured and stable approach. Transparency is extremely important, that the general public understands what the actual situation is, what the prospects are, and most importantly, as Dr. Shanahan said, what they can do, how they can contribute to alleviating the crisis. And there's so much that individual citizens can do in every country to prevent the spread of this terrible disease. And that's the kind of leadership that we are looking for, and we are seeing it in Dr. Fauci, for example, made this very same point that the worst is yet to come in some places. Hopefully that will not prove to be true, but that we ought to at least be prepared for that situation.
I agree. We need to be prepared for the worst. Our leaders need to be straight with us, I think. Well, that's all we have time for today. It's been a very interesting discussion. Thank you so much for joining us, Dr. Mark Shanahan in Reading and Dr. Joseph Bosco in Washington, D.C.
Thank you.
Thank you.
This is also where we wrap up our show today. Thank you for watching. Join us at the same time tomorrow for more global insights on issues making headlines. Until then, have a lovely day or evening wherever you are. Goodbye.